Hi, I'm Dr. Teach Karajian, and I want to talk to you about why many practitioners fail with patients that suffer from gastrointestinal complaints. Well, one of the main reasons is because many practitioners just have a protocol. A patient comes in and they go, well, everything starts in the gut. Let me get that treated first, and they just have their routine protocol. So they'll put the patient on their favorite probiotic and favorite enzyme and this favorite package of supplements to try to restore the gut. And then they just put them on a diet to cut everything out, and then they cross their fingers, hope the patient gets better. Well, that's really an ineffective and inefficient way to really treat gastrointestinal problems. And one of the things that you really want to avoid as a healthcare professional, you really want to figure out the mechanism of the condition. So, for example, if someone comes in complaining of constipation as their chief complaint, you really want to go through all the main mechanisms, right? Maybe their constipation is due to the fact that they have issues with their brain gut access because they had a traumatic brain injury that's catching up with them and they can't activate their vagus. Maybe their constipation is due to the fact that their enteric nervous system in the gut has degenerated away. Maybe their constipation is due to the fact that they have different gases released in their gut, like methane, that shuts down motility. Maybe their constipation is due to the fact that they're considering medications that are impacting their gut. Maybe they have dysautonomia, where they can't activate the parasympathetic systems. So, you can go down the list and you can look at all the different mechanisms, starting with the brain, all the way down to the endocrine system, to the immune system, and to the microbiome itself, of all these different ways that can cause constipation. And we'll be going over all those types of clinical mechanisms in the Karazian Institute Gastrointestinal Clinical Strategies and Treatment Applications module. But it's important to realize that that's one way to work up constipation. So one of the things that most practitioners don't do is they just immediately jump into protocol and not really go into the mechanism and the physiology of why the patient has that chief complaint. And if that's overlooked and missed, it's certainly guaranteed that just throwing supplements at a patient with some random protocol is probably going to be ineffective for many of them. Now, it's still important to work up a patient and come up with a diagnosis of, do they have a gastric ulcer, do they have small intestinal bacterial overgrowth, do they have inflammatory bowel disease, they have Crohn's disease, they have ulcerative colitis, whatever the diagnostic mechanisms are, kind of on a horizontal scale kind of thing with what these different clinical mechanisms could be. But then in a vertical pathway, you've got to go through all the different mechanisms for the chief complaints, and then when you overlap them, you can develop a very effective clinical strategy and treatment application. So I think one of the things that happens in the healthcare field is that there's just this shotgun approach to treating the gut. There's not much specificity, and there's this assumption that if you just treat the gut with various supplements, that everything should get better. But in a real clinical scenario, especially working with chronic patients, that's not how it works. So hopefully we can expose you to all these very important clinical thought processes and clinical evaluation processes, so you can develop the most efficient treatment plan for your patients. So check us out. Check out the gastrointestinal module at the Karazian Institute called Gastrointestinal Clinical Strategies and Treatment Applications. Thank you for your time.